Inflammation is such a buzzword right now. So can you tell me what exactly is it? What exactly is happening inside the body when you have inflammation?
So what happens, our bodies are great guardians for our well-being and our health. So if we get pricked by a splinter, if we get an infection with a virus or a bacteria, our defense systems immediately go into action to try and protect ourselves. And this is the onset of the inflammatory process. It's protection. And we might see redness, swelling, pain, heat over an area where we do have such an injury. And that's our white blood cells going into action to try and combat this acute insult to our body, this inflammation. And that's what we call our innate inflammatory control process. But then we are sophisticated beings. We are as humans and as other animal parts of our kingdom. And we have an adaptive immune system as well. And this is what most of us are really more familiar with, in that it forms antibodies to help protect us, not just now, but with memory, we can protect ourselves in the future as well.
Okay, so that's inflammation when I have a problem, right? What
That's
if
correct.
I'm not aware that I have a problem? I can still have inflammation, right?
That is absolutely correct. And that's where the whole concept of autoimmunity comes into play. And that is, we all have a condition we call tolerance, which means our bodies don't attack ourselves. That is not normal. Again, our bodies are very clever and we guard ourselves and protect ourselves. But sometimes there is a disturbance in the immune system, what we call dysregulation. And what that means is that now all of a sudden, our bodies turn on ourselves. And that is, we start forming antibodies against ourselves, and that's not normal. But unfortunately, that sets up a disease. And these can take on many, many different faces. And this in different types of conditions. You might see this. It could be in rheumatology, cardiology, endocrinology, neurology. So it's many, many different diseases that can be associated with this concept of autoimmunity. So what happens, Marianne, is that our certain special white blood cells called B cells and T cells, we don't have to remember all that for now, but that's the seat of the entire inflammatory immune process. And this then will form and produce many different types of inflammatory substances that mediate the inflammation in our bodies. We might feel pain in the muscles, pain or swelling of the joints, chest pain, because we might get inflammation around the lungs called pleurisy, inflammation around the heart called pericarditis. We might have neurologic brain involvement, kidney involvement, and it can affect many, many different parts of our bodies. So when these inflammatory mediators get into the mix, it causes inflammation, the same kind of response we had with the splinter in our skin, but there it causes damage to an organ, the joint, the muscles, the skin, heart, kidneys, brain. This can be devastating to a patient. Some of the symptoms would be pain. It could be unexplained fevers, skin rashes, like I said before, chest pain because of involvement in the internal organs like the heart and the lungs, kidney failure, all these different things. Fatigue. You just will have weight loss. You will have a loss of appetite. You don't feel yourself.
So then how can you help people? What's the treatment?
This is the time to get to your physician. You might see your primary care physician at first. If it's more in the joint, you might see a rheumatologist, the skin, a dermatologist. There are different physicians that might come into play in the initial part, and eventually you have to someone to coordinate all of this care. Laboratory studies can be very, very helpful in trying to further define this inflammatory process and try to narrow it down to see what is it? Is it rheumatoid arthritis? Is it lupus? Is it multiple sclerosis? Is it diabetes? So it used to be if you have one of these autoimmune conditions, this was almost like having cancer. And that is, you would have a deteriorating course in your life. But fortunately, over the last 30 years, we've had a tremendous, tremendous breakthrough in the development of very effective types of medication to combat this inflammation and try to neutralize all of these very intense, potent inflammatory substances in our bodies causing the damage that I was alluding to. And these are called biological agents or monoclonal antibodies. And there are other drugs which are not just injectables, but also oral pills that are available to also accomplish the same thing. The key thing is early recognition, be seen by a physician early, be seen by the appropriate type physician who is familiar with these things, be treated, and live your life the way you choose to have it done.
Thank you so much, Dr. Fisher. That is wonderful information. Thank you.
You're very welcome. It's my pleasure.